Let's draw it first. It is a continuation of subclavian artery, as you all know. This is humerus, this is scapula part, upper part, and let's draw the muscles. This is pectoralis minor, and this is teres major. These are two of the muscles. And coming to here, you have the first rib. From the first rib it starts, and here it is called the subclavian artery. And after passing up to here, up to the scapula, then it is called the axillary artery. It passes beneath the pectoralis major and onto the teres major. Beneath the pectoralis minor onto the teres major. Here, after passing this teres major, we call it as brachial artery, as it continues in the arm next to the forearm. In the forearm, it divides into, in the cubital fossa, it actually divides into radial and ulnar arteries. This is the course of axillary artery. As it passes, it is crossed by the pectoralis minor. The crossing of this muscle divides the axillary artery into the first part, second part, and the third part. First part is superior and or proximal to the muscle. The second part is posterior or deep to the muscle, and the third part is inferior or distal to the muscle. That's all about the three parts course. And axillary artery is related to the corresponding walls of axilla and accompanied by the axillary vein on the medial side. The first part of the axillary artery is enclosed by the axillary sheath that is derived from the prevertebral layer of deep cervical fascia. I'll explain by the diagrammatic representation so that you can understand very easily. Starting with the axillary artery, this is the first part we are talking about. And here you have anterior, posterior, lateral and medial relationships. And coming to the anterior relationships, you have skin, superficial fascia and deep fascia common for every part. And pectoralis major is common for first and second parts. First you have the pectoralis major muscle, and it has two fascias covering. Upper fascia is the pectoral, lower fascia is the clavipectoral fascia, and upper fascia is the pectoral fascia. We have, and these three are the anterior relationships, and we have another anterior relationship I will tell you in the last. And then coming to the posterior relationships, we have the long thoracic now, or we can call it the now to serratus anterior, and first and second distillations of serratus anterior, and medial cord we have posterior. First, let's draw the first and second distillations of the serratus anterior, and then the long thoracic now, or now to serratus anterior, and then the medial cord of brachial plexus. These three are the posterior relationships. Next, we have the lateral relationships, or medial relationships. We have only axillary vein, which is common for everything. This is the axillary vein. And coming to the lateral relationships, we have lateral cord of brachial plexus and posterior cord of brachial plexus. Both come under the lateral relations. And these two, the lateral cord and the medial cord, supplies to the pectoralis major muscle. This is the lateral cord, this is the medial cord, and there's a loop of communication between the lateral and medial pectoral nerves. I told you this was the another anterior relation which I told you earlier. These are the relations. First, we draw the axillary artery, and then we have the anterior relationships, which include skin, superficial fascia, and deep fascia, and we have the muscles, pectoralis major and pectoralis minor. This is pectoralis minor, and above it is pectoralis major. Pectoralis minor is covered by the clavipectoral fascia. This is the clavipectoral fascia. And then we have the posterior relationships, which include the subscapularis muscle. And then we have the posterior cord of brachial plexus. Here, the brachial plexus relations are very easy to remember because we have posterior cord of brachial plexus posteriorly, and lateral cord of brachial plexus laterally, and medial cord of brachial plexus medially. Okay, that's all about the posterior relationships. Coming to the medial relationships, we have the axillary vein as usual, and then we have the medial cord of brachial plexus, or the medial pectoral now, and then we have, sorry, that is the medial cord of brachial plexus, and we have the medial pectoral now also medially. And then coming to the lateral relationships, we have the coracobrachialis muscle and also the lateral cord of brachial plexus. That's all about the second part of the axillary artery. To the third part of axillary artery, we have the axillary artery first, and then we have the pectoralis major as usual, and then anterior relations, and then we have the medial root of median nerve anteriorly. These two are the anterior relations, and coming to the posterior relations, we have the subscapularis muscle, and above it are the axillary nerve and also the radial nerve. These three are the posterior relations. Coming to the medial relations, we have the axillary vein as usual, and then we have the uh, upper one is the medial cutaneous nerve of forearm, and uh, afterwards we have the medial cutaneous nerve of arm, and also we have the ulnar nerve medially. Coming to the lateral relations, we have the coracobrachialis muscle, and above it is the short head of biceps brachii, and we also have the musculocutaneous nerve and lateral root of median nerve. Sorry, the above one is the lateral root of median nerve, and the below one is the musculocutaneous nerve. This is the lateral root of median nerve and musculocutaneous nerve. Part of the third part of axillary artery, and now I'm going to talk about the distal part of the third part of the axillary artery. We have the anterior, posterior, lateral, and medial relationships as usual. Firstly, you have the skin, superficial fascia, and deep fascia. And first, we should draw the axillary artery. I forget. This is the third part of the axillary artery. And anterior relationships include only the skin, superficial fascia, and deep fascia. And posterior relations include tendons of two muscles and a radial nerve. This is the tendon of teres major, and this is the tendon of latissimus dorsi. And then we also have the radial nerve over here. I forget to draw the radial nerve. And medial relations, we have the axillary vein as usual, and we have the medial cutaneous nerve of forearm, medial cutaneous nerve of arm, ulnar nerve. These are the medial relations. And coming to the lateral relations, we have the coracobrachial. This is, yeah, I forget to draw. I said no, radial nerve. This was, and we have the coracobrachialis laterally and short head of biceps brachii. We also have the musculocutaneous nerve and also the median nerve. That's all about the third part of the axillary artery. In the first part, you have one branch, and then the second part, you have two branches, and in the third part, you have three branches. Coming to the first part, you have the superior thoracic artery. This is the superior thoracic artery. It is a very small branch that arises from the first part, which is runs along the superior border of the pectoralis minor muscle, and it supplies the pectoralis major and minor muscles and the thoracic wall also. And secondly, from the second part, we have the two branches. First one is thoracoacromial artery. It has thoracoacromial trunk, you can call it, because it have four further branches: the pectoral branch, the deltoid branch, the acromial branch, and the clavicular branch. These are the four branches of the thoracoacromial trunk. Then we have the lateral thoracic artery. This is not the lateral thoracic artery, it is subscapular artery of the third part. This is the lateral thoracic artery. The thoracoacromial trunk and lateral thoracic artery are the two branches of the second part. Third part is, in the third part we have the, already I said that, subscapular artery, and then we have the posterior circumflex humeral artery. This is the posterior circumflex humeral artery, and that runs along the posterior border of the humerus. And we have the anterior circumflex humeral artery that runs along the surgical neck of humerus. This is the anterior circumflex humeral artery. Also, the anterior circumflex humeral artery anastomoses with the posterior circumflex humeral artery to form an articular circle around the surgical neck of humerus. It gives off an ascending branch which runs in the intertubercular sulcus and supplies the head of humerus and shoulder joint. For the labeling part, I added the diagram from BT Shauja. You can refer it. And finally, thanks for this. If you find this informative, subscribe.